We now discuss diagnosis according to pathogenic qi. We continue with cold. Symptoms and signs of specific invasions of cold patterns. In wind cold, there is aversion to cold and wind, chills, headache, stiffness in the shoulders and neck, lack of sweating, coughing, sneezing, clear watery secretions from the nose, slight or no fever, itchy throat, no thirst, and with a superficial, tight, and slow pulse. In cold B, this is B syndrome, where cold is the predominant pathogen. The movement of the joints are inhibited and there will be severe pain due to stagnation of qi and blood. The pain will be localized and will be intense. The pain is ameliorated by heat and motion, and worse when exposed to cold and when there is inactivity. There will be a general aversion to cold, no sweating, and therefore increased urination, chills, and possibly muscle twitching. There will be a superficial, tight, and slow pulse. Cold in the stomach, there will be acute epigastric pain, explosive vomiting of clear fluids, acute sensitivity to cold. The symptoms will be provoked by the ingestion of cold foods and drinks, which often leads to vomiting. Symptoms are alleviated by heat. Stomach area will feel cold on palpation. Tongue will have a thick white coating and pulse will be deep and tight, confined, and slow, especially in the right quan positions. For cold in the intestines, there is acute pain in the abdomen, painful watery diarrhea, acute sensitivity to cold. Skin of the abdomen may feel cold on palpation. There may be cold extremities with thick white tongue coating, deep, tight, confined, and slow pulse, especially in the sure positions. For cold in the uterus, there will be cramping and biting menstrual pain, long menstrual cycle, brown menstrual blood containing clots that look like coffee grounds, infertility, the area above the pubic bone will feel cold on palpation, thick white tongue coating, deep, tight, confined, and slow pulse, especially in the sure positions. Treatment principle, expel cold. If there is wind cold, we use lung 7, Li4, Si3, UB62, Do14, GB20, bladder 10, and bladder 12. If there is cold B, Li4, Ren6, and Do14, as well as local and distal acupuncture points along the appropriate channel. If there is cold in the stomach, we use stomach 21, stomach 34, spleen 4, Ren6, Ren13, bladder 21, and pericardium 6. If there is cold in the intestines, we use stomach 25, stomach 36, stomach 37, Ren6, Ren8, spleen 4, spleen 9, and bladder 25. And if there is cold in the uterus, Ren4, Ren6, Do4, bladder 23, kidney 3, kidney 7, kidney 13, and stomach 29. We use a draining or sedating needle technique, and moxa is recommended. Lung 7, Li4, Si3, bladder 62, Do14, GB20, bladder 10, and bladder 12 all expel wind and cold, as well as activating Wei Qi. Kidney 3, kidney 7, Do4, Ren4, Ren6, and Ren8 warm and activate Yang Qi. Stomach 21, stomach 25, stomach 34, stomach 37, bladder 21, and bladder 25 expel cold and regulate Qi in the stomach and intestines. Spleen 4 regulates Qi in the stomach and intestines. Pericardium 6 regulates Qi in the middle jaw. Spleen 9 drains damp cold. Kidney 13 and stomach 29 expel cold from the uterus. When there is cold, it is best to avoid consuming food and beverages that are physically cold or have a cooling energy. It is beneficial to drink ginger tea or ingest other spices that have a warming and diaphoretic energy. It is important that the body is kept warm and dry. Invasions of cold can be caused by Wei Qi deficiency and Yang deficiency. And invasions of cold can result in Yang deficiency. Thank you very much for listening.